Hello everyone, I'm Scott Steurer, and this is my capstone for the Masters of Science in Exercise Science. And my study proposal is for the effects of prenatal resistance training on postpartum diastasis recti recovery. So diastasis recti abdominis, which is the separation of the rectus abdominis along the linea alba, is a common affliction affecting 66 to 100% of pregnant women in their third trimester, and more than 53% of women in the postpartum period. For some women, DRA does not self-resolve postpartum, and one study found that 39% of women continue to show signs of DRA several years later. Due to the importance the rectus abdominis muscles play in maintaining posture and stability, women who suffer from DRA may be impacted by poor posture, lumbopelvic pain, urinary incontinence, and a high prevalence of lumbar spine and pelvic injuries. Physical activity is highly encouraged for all healthy pregnant women who have been approved to exercise by the providers. In fact, the recent 2018 update to the American College of Obstetrics and Gynecology, or ACOG, guidelines urges women with uncomplicated pregnancies to participate in moderate intensity physical activity for a minimum of 150 minutes per week. Additionally, resistance training has been discovered to lessen the occurrence of ante and postpartum urinary incontinence, as well as improve cardiorespiratory function. It is considered to be beneficial for fetal development and can decrease the risk of gestational hypertension and gestational diabetes mellitus. Furthermore, resistance training can offer pregnant women improved quality of life and self-esteem. One study has shown that only 24% of OBs regularly discuss exercise with their patients, despite the guidelines set forth by ACOG. Despite the high prevalence of DRA, as well as the benefits exercise provides to women during pregnancy, there is no mention of potential advantages exercises may have on DRA. Arguably, the research concerning any beneficial effects prenatal exercise could have on diastasis recti is minimal at best. After a thorough search on ClickSearch yielded no results using search parameters for the past 10 years and keywords diastasis recti, prenatal, pregnancy, exercise, resistance training, the search was widened to incorporate 20 years, which produced only one article. In this study, they found that women who performed prenatal resistance training had a smaller separation compared to the non-exercise group. However, there were many limitations to this study, such as a limited sample size, differences in literature on how much separation constitutes diastasis recti, and no pre-exercise measurements of DRA. The aim of this study was to examine the effects, if any, that abdominal resistance training has on the recovery process of postpartum diastasis recti. More specifically, this study will compare the differences antenatal resistance training, aerobic training, and a combination of resistance training and aerobic training will have on the rate at which DRA heals in the postpartum period following a full-term singleton pregnancy for women whose newborns were considered to be average for gestational age. Pending the results of this study, appropriate agencies such as ACOG will be given an opportunity to review in an effort to determine whether or not this aspect of antenatal care should be considered. Now, on to the methods portion of this study. We'll start with the participants. So 30 pregnant women between the ages of 20 and 40 years of age and within the first trimester of gestation, which is 8 to 12 weeks, of a singleton pregnancy will agree to participate in prenatal portion of the study. This will be a randomized control study where the women will be split into two groups consisting of the resistance training group, or resistance and aerobic training, and the control group, which will be aerobic training only. Women will be recruited by recommendation from local OB/GYN offices. Flyers explaining the study will be provided to the physicians to hand out and educate their patients. Women will be excluded from participation if they are carrying multiple fetuses or their pregnancy is considered to be high risk, to include but not limited to hypertension, preeclampsia, diabetes mellitus, lung and/or heart conditions, cervical insufficiency, or drug and alcohol use. Additionally, exclusion included women in both groups if they have participated in resistance training within the past 90 days. For the postpartum portion, participants of the 30 women who will participate in the prenatal segment, only those who are diagnosed with diastasis recti by their physician will be included for the postpartum portion of this study. Participants are excluded if they are not cleared by their physician to begin physical therapy 6 weeks postpartum. For the purposes of this study, diastasis recti is considered the separation of the rectus abdominis along the linea alba greater than or equal to 25 millimeters. Prior to testing, all women will read and sign a statement of informed consent. The instrument used will be an ultrasound to measure the interrectus distance, and the ultrasound is considered the gold standard for non-invasive IRD measurement. For this particular study, we'll be using the GE Logic E system interface with two-dimensional high-frequency linear transducer in V mode. For the procedures, we'll start with the prenatal. For the prenatal treatment, the two groups will be instructed to follow current 2018 ACOG guidelines that include participating in 150 minutes of moderate intensity exercise per week. This will be split into 5 days, 30-minute sessions for both groups. The board rating of perceived exertion, or RPE, will be used to monitor the intensity level of the exercise, with a rating of 6 perceiving no exertion at all to 20 perceiving maximal exertion. The women will be instructed to keep their rating between 12 and 14. Both groups will be given the standard physical activity readiness questionnaire form and will be briefed on their roles in the study during initial treatment. Both groups will be given exercise logbooks along with their respective exercise instructions. Both groups will be required to attend group training twice per week with certified personal trainers who are credentialed by the National Commission of Certifying Agencies organization. Participants will also be instructed to exercise on their own 3 days per week. The resistance training group will exercise with the personal trainers 2 days a week for the resistance training and 3 days a week of aerobic training on their own. Participants will be instructed to log the type of aerobic activity conducted as well as the RPE readings for both aerobic and resistance training activities in their logbook. For the complete list of resistance training exercises for the first trimester, see Table 1, second trimester, Table 2, and third trimester, Table 3. The aerobic training group will accomplish 2 days of aerobic training with the personal trainers and 3 days of self-prescribed aerobic training. The aerobic training group will consist of aqua aerobics taught by the certified personal trainers for the 2 days. For the self-prescribed aerobic training, the participants will be instructed to log their activity type along with their RPE rating in their respective logbooks. For the IRD measurement, the measurement will take place at 4 locations along the linea alba. It will be 3 centimeters above the superior border, 5 centimeters above the superior border, and 3 centimeters below the inferior border of the umbilicus. This will be conducted by a certified sonographer, and there will be 4 total measurements, with the first initial measurement at 6 weeks postpartum, and then 3, 6, and 9 months postpartum. The postpartum treatment, upon clearance from their physician and after their initial IRD measurements, participants will start the physical therapy program 6 weeks postpartum. Participants will work directly with a licensed physical therapist 1 day per week to monitor progress for 7 total weeks. The physical therapist will The 7-week physical therapy program can be seen on Table 4. After completion of the 7-week program, the physical therapist will hand out discharge instructions for the participants to complete for the remainder of the study. For statistical analysis, the data collected in this study will be analyzed using the SPSS version 20. Descriptive statistics will be used in the form of means and standard deviations. A paired t-test will be used for comparing within groups, and an independent t-test will be used to compare between groups. Significance will be based on p less than 0.05 for all tests, with p less than 0.01 indicating a high significant result. Incorporating resistance training exercises in the prenatal exercise regimens may arguably decrease the incidence and magnitude of diastasis recti, as well as the recovery time for diastasis recti in postpartum women. This type of study would demonstrate to what degree there can be truth to this hypothesis with a small sample of women. The sample size of the participants would be considered a limitation, and a larger sample size of women would serve to validate or invalidate initial studies. Another limitation of the study could be noncompliance, in that participants will be required to maintain accountability to themselves as well as to their trainers in the form of actually performing physical activity on their own, as well as maintaining an accurate logbook. Submitting a study such as this to ACOG would serve to positively influence dialogue between one's prenatal provider and the patient, since at least one recent study has shown that as many as 76% of OBs do not discuss an exercise regimen with their pregnant patients. Additionally, this study could be the first published research regarding how resistance training could lessen the incidence and impact of diastasis recti for postpartum women. Future recommendations in support of incorporating resistance training into prenatal exercise regimens in an effort to lessen the incidence and impact of diastasis recti would be to broaden the criteria for participation to include all pregnant women of any age, gravidity, parity, and or multiple gestations. I'd like to thank you very much for taking the time to listen to my proposal. If you have any questions, I'm glad to answer.